Shattering the myths about addiction. Online event presented by Magdy Ziyadah, supervision by Dr. Anthony Andrews. Shattering the myths about addiction introduction. Welcome to our online event where we aim to explore the science behind addiction, challenge prevailing myths, and foster a deeper understanding of this complex issue. Addiction is a multifaceted problem that affects individuals, families, and communities. By sharing scientific facts and personal reflections, we hope to promote empathy, reduce stigma, and encourage meaningful conversations about how we can address addiction society. Part 1. Understanding addiction. What causes it? Addiction is not a simple choice or moral feeling. It is a chronic brain disorder influenced by a combination of biological, psychological, and social factors. Let us explore some of the major theories of addictions. Biological theory. Addiction is linked to changes in the brain's reward system. Drugs and addictive behaviors flood the brain with dopamine, creating a powerful reinforcement loop. Over time, the brain adapts, leading to tolerance and dependence. 2. Psychological theory. Trauma, stress, and mental health disorders like depression or anxiety can increase vulnerability to addiction. Many individuals turn to substances or behaviors as a way to cope with emotional pain. Social and environment theory. Factors such as poverty, lack of education, peer pressure, and exposure to drugs in one's environment play a significant role in addiction. Social isolation and stigma can also exacerbate the problem. Reflection on changing perspectives. Before learning about these theories, I used to think addiction was primarily a result of poor choices or weak willpower. However, understanding the science behind addiction has shifted my perspective. I now see it is a health issue that requires compassion and evidence-based solution rather than judgment or punishment. Part 2. Prevalent drugs and addictive behaviors in the USA. In the United States, certain substances and behaviors are particularly prevalent and problematic. 1. Opioids. The opioid crisis remains one of the most devastating public health issues. Prescription painkillers, heroin, and synthetic opioids like fentanyl have led to a sharp increase in overdoses and deaths. 2. Alcohol. Alcohol use disorder affects millions of Americans and contributes to a wide range of social problems, including accidents, violence, and chronic health conditions. 3. Methamphetamine and cocaine. These stimulants continue to pose significant challenges, particularly in certain regions of the country. 4. Behavioral addiction. Gambling, social media use, and gaming addiction are becoming more recognized as serious issues, especially among younger population. Which drugs or behaviors create the most problem? Opioids and alcohol. are currently the most damaging due to their widespread use and the severe consequences they have on individuals and society. However, behavioral addictions are increasingly problematic as they often go unnoticed and untreated. Part 3. Addressing addiction, individual and societal approaches. To effectively address addiction, we need a multifaceted approach that combines individual support and systemic change. 1. At the individual level, education. Teach people about the risks of substance use and the science of addiction. Early intervention. Identify and address risk factors such as trauma or mental health issues before they lead to addiction. Treatment. Provide access to evidence-based treatments, including therapy, medication-assisted treatment, and support groups. At the social level, reduce stigma, challenge stereotypes, and promote understanding of addiction as a health issue, not a moral feeling. Policy changes. Implement policies that regulate the availability of addictive substances, such as stricter controls on prescriptions, opioids, and alcohol advertising. Community support. Invest in community programs that provide education, prevention, and recovery resources. Part 4. Shattering the myths. Let us take a moment to debunk some common myths about addiction. Myth 1. Addiction is a choice. Fact. Addiction is a brain disorder that impairs self-control and decision makings. Myth 2. Only certain types of people get addicted. Fact. Addiction can affect anyone, regardless of age, race, or socioeconomic status. Myth 3. You have to hit rock bottom to recover. Fact. Recovery can begin at any stage, and early intervention often leads to better outcomes. Conclusion. A call to action. Addiction is a complex issue, but it is not insurmountable. By educating ourselves, challenging myths, and advocating for compassionate policies, we can make a difference. Let us work together to create a society that supports recovery and reduces the harm caused by addiction. Thank you for joining us today. We hope this event has inspired you to think differently about addiction and take action in your own community. I would like you ask a question about addiction and share your thoughts with us. Thank you and goodbye.